It's a beautiful day in the neighborhood, a beautiful day to celebrate National Sexual Health Awareness Month with Dr. Renzo Corzano and Dr. Phyllis Ritchie. This is Ask a Gay Doc. Make sure you like us and subscribe on our KGAY YouTube channel. It's a Sexual Health Awareness Month. I want to know, what are you guys seeing? Renzo, what's happening in your office when it comes to sexual health?
A lot of education recently about things like DoxyPet for like STD prevention. I've also started to like increase the amount of like anal paps that I'm doing to screen for HPV.
Is that like anal warts?
It can give you anal warts, but sometimes it can actually cause like anal cancer.
Right.
So we're screening a lot, and there's like a very specific guideline that we have to use. And the reason why we're doing so much of it now is actually because we just opened up our like high resolution anoscopy clinic on campus, and so we're able to do a lot more HPV screening, to be able to refer if we need to.
Dr. Phyllis Ritchie, you have the free STI testing and treatment clinic, PST Test, at healthypsttest.org. What are you seeing?
We see a lot of sexually transmitted infections, gonorrhea, chlamydia, a lot of syphilis. As of late, we've been seeing tertiary syphilis. And
Wow.
one patient of note came in with hearing loss and kept going back to his ear, nose, and throat doctor. And turned out he came to our clinic. We got an RPR, which is a syphilis test, and he was positive and treated him. So doctors out there should remember to always check an RPR. So we had 2 cases like that.
Now, what is tertiary syphilis?
Tertiary syphilis, there's 3 stages of syphilis: primary, secondary, and tertiary. And tertiary, primary is when you have a chancre or an open sore, it's painless. Secondary is when it goes into the body, and tertiary is when it goes to further organs, for instance, the brain, the heart, etc. And this one went to the ear nerve area and caused hearing loss. It was permanent. He has not regained his hearing.
So
Wow.
people can't really take these things too lightly. It's not like you're going to get a pill and it's over with. If people have no symptoms and they are very sexually active, should they be tested on a regular basis?
Absolutely.
Jinx.
No, but it's interesting because especially syphilis, like in a LGBT population, especially gay men, if they're engaging in like receptive anal sex, you can get like a chancre in your anal mucosa, and because it's painless, they don't really feel it. They don't really know they have it, and that's how it can progress to like secondary, tertiary syphilis. So absolutely, especially in this area. I mean, I test my PrEP patients and my HIV patients for syphilis like every 3 months.
Yeah, that's what we recommend too. We went to the Palm Springs Order of the Desert meeting a couple of nights ago, actually, and told them, please come in every 3 months if you're sexually active with various partners. Come in every 3 months, even if you're asymptomatic, because you're right. You'll miss those open sores or painless chancres, they're called. About 10 years ago, when I was here, we got emails from the county warning all physicians about vision loss with syphilis, and be on the lookout for that. So that's another way that syphilis can affect the body, is vision loss. Usually that's reversible, but sometimes not.
Wow. This is a good month to be talking about these things with National Sexual Health Awareness Month. And you're doing some great work at healthypsttest.org. People can go and get STI testing and treatment free of charge. You guys have run into some fundraising challenges, and I know you've been like paying out of your pocket to stay open. And I know PSLOD just made another donation to the PS test, which is awesome. And we really encourage people, now is a good time to donate. How do they do that, Phyllis?
They go to healthypsttest.org, and there's a donate button. I have to tell you though, John, our community has come to our support. Unbelievable. Thanks to you too. We just got a $5,000 donation from Broadway Cares in New York. So just really heartwarming.
Yeah, well, we got to keep it open and we got to keep it running at full capacity, because as we move into season, we do get a lot of people that come from other places, and they might be bringing some uninvited guests, if you know what I'm saying.
Yeah,
Yeah.
and I mean, well, Renzo will know too, but the next concern, or the concern we're worried about is Mpox clade 2, and that's a big one.
Yeah. And is there vaccines for that that are specific to clade 2 that are out now?
Yeah, well, it's the same vaccine. It's Jynneos, 2 doses. If you got 1 dose for clade 1, just get your second dose. It's gonna come. Don't you think so, Renzo?
Oh, absolutely. I mean, we did a show on this, and it's just a matter of time.
I agree. And the mortality rate, they estimate it has been in a smaller area, but they estimate to be about 10%.
Sexual Health Awareness Month. Thank you for keeping us aware. Ask
Thanks.
a Gay Doc. You can ask a question by going to your email and sending one off to Dr. Renzo Corzano at lgbtqhealth@mydohc.com. You can go to the website of healthypstest.org, make a donation, make an appointment, and make sure you're aware of your sexual health. Thank you both for everything you do.
Thank you.
Thank you, Phyllis.
Thank you, Renzo. Thanks, John.
Hey, it's John Taylor. Thanks for watching our video. And don't forget to like and subscribe to our KGAY channel so you won't miss anything going on in the neighborhood. And you can always listen live to KGAYPalmSprings.com.